Do you know that some women suffer gestational diabetes even when they've never had diabetes before in their life? Hey guys, welcome back to my channel. My name is Precious and I'm a registered nurse. Okay, so in today's video we'll be talking about a very serious pregnancy complication known as gestational diabetes. It is also called GDM. Okay, so in today's video I'll be telling you what gestational diabetes is, the signs and symptoms, the causes and risk factors, how it is diagnosed, and most importantly how it can be managed to keep the mother and the baby safe. This is a condition that affects some women during pregnancy, and though it sounds scary, the good news is that with the right care, most women go on to have healthy pregnancies and healthy babies. So if you're pregnant or you're planning to be pregnant, this video is for you. So what exactly is gestational diabetes? Gestational diabetes is a type of diabetes that develops during pregnancy. It happens when your body cannot use insulin properly, causing high sugar level in pregnancy. What is insulin? Now, insulin is a hormone that helps your body turn glucose or sugar into energy. Okay, during pregnancy, hormones from your placenta can make your body resistant to insulin, and this insulin is actually produced by the pancreas. Okay, so for most women, the pancreas actually makes extra insulin in order to balance the glucose in the body, but for some it's not enough. Like, the insulin is not enough, and that is when there's an increase in your glucose level as a pregnant woman, leading to what is called gestational diabetes. So who are at risk or who are predisposed to having this gestational diabetes? Number one is people that are obese. That's a woman that is obese or overweight before or during pregnancy. Another one is a woman that is above 25 years old. So if you're a woman that is above 25 years old, there's likelihood of you developing gestational diabetes during pregnancy. Number three is if you're having a family history of type 2 diabetes. So this means that in your family, if there is a number of people that already have diabetes, then you as a woman can be predisposed to having this gestational diabetes. Number four is if you've had gestational diabetes in your previous pregnancies, that you've been pregnant before and then during your pregnancy it was recorded that you have an increase in your glucose level. If you're pregnant again or your subsequent pregnancies, the likelihood of you having gestational diabetes is very high. The last one is a woman with polycystic ovarian syndrome is also predisposed to having gestational diabetes. So these are risk factors for women that are at risk of having gestational diabetes. But there's something you need to note. Okay, even if you don't have all these risk factors that I've listed, there's still possibility of you as a pregnant woman having gestational diabetes. So this is a call out to every pregnant woman out there to endeavor to be screened during pregnancy in order to rule out gestational diabetes. Okay, one tricky thing about this gestational diabetes is that for some women there's no sign, like there's no obvious sign, but then there are some key signs to look out for. Okay, number one is that this gestational diabetes, which I'll call GDM, okay, comes with frequent tests for water. Okay, you constantly notice the dryness of your throat, you want to quench that thirst. So if you notice a frequent thirst, it's a sign. Number two is an increased urination. If you notice an increased urge to urinate, okay, you're always going to the restroom to ease yourself to pee, is a sign. Another sign is blurred vision. You notice that you can't see clearly. There's something in there, as if you keep wiping your eyes to see clearly. Is a sign of gestational diabetes. Another one is fatigue. This unexplained tiredness, fatigue, you feel so weakened. Your body, your muscles are so weak, is a sign of diabetes. Even though these things or these signs I've just listed kind of look like pregnancy symptoms, right? Yeah, can still be a sign of gestational diabetes. And that is the reason why you have to go to the hospital to be screened to at least rule out gestational diabetes. But honestly, most women actually feel normal. So most women don't even have some signs of this gestational diabetes. Okay, and now you're watching me confused. How will I know if I have gestational diabetes? Now let me tell you, usually between 24 and 28 weeks of pregnancy, a screening is being offered to you as a pregnant woman, and it is called glucose tolerance test. Okay, so this test is done usually in the morning. Okay, so before you come for this test, you'll be asked not to eat for 12 hours. Like, don't take anything, food. Even if you're diabetic before now, don't take your medication. Okay, but if you're not, just don't take anything that will increase your glucose level, but you can take water. Okay, so 12 hours. So when you get to your test facility or your hospital, a sample of your blood will be taken, which is called the fasting glucose level. Okay, and then you'll be offered a sweet drink. This drink tastes like Capri Sun, so it's a sweet drink. Okay, it has enough glucose in it. So after taking this drink, you'll be asked to wait for like 2 hours. So after 2 hours, another sample of your blood will be taken to test for the level of glucose in your blood before you drank something that has glucose, and then to test for the level of glucose in your body or your bloodstream after you've taken that sweet glucose drink. Okay, so after this test is done and your glucose level is stable or is normal, you be allowed to go home, right? But at the long stage of your pregnancy, if there's still an increase, or peradventure there is an increase or you noticed increase in your blood glucose level, you still be asked to come back to repeat the glucose tolerance test. Okay, you might be wondering, why is this gestational diabetes such a big deal? Like, don't we all eat glucose? So why are we bothered about it? Now the thing is that when this glucose in your body is so increased, that's when your insulin can no longer handle it. This may lead to you having a larger baby. It is called fetal macrosomia, which can cause complications during delivery. Number two is that it can lead to a woman having her baby through cesarean section. Number three is that there's possibility of a woman having gestational diabetes to give birth to a child having low blood glucose level immediately after birth. I know that a child that is hypoglycemic can actually lead to death. Okay, number four is that both mother and baby can come down with type 2 diabetes, okay, later in life. Good news, the good news is that there's a treatment and management for gestational diabetes. Mind you, treatment does not always mean medication. Yes, most times it can be handled by the lifestyle changes a woman takes up. Okay, number one is eating healthy. Okay, eating a well-balanced diet. So this is an example of what your plate of food should look like. At least it's advised you add 1 or 2 of each of this to your plate of food, okay, in order to make it balanced and also prevent you from increasing your blood glucose level. So number one is half of your plate should contain non-starchy vegetables. Okay, so example of this is spinach, broccoli, cucumber, cabbage, tomatoes, lettuce. Okay, so while this non-starchy vegetable is advised, is that they are low in carbohydrates, okay, and they are high in fiber, and also they also help slow down your blood sugar level. Okay, then 1/4 of your plate should have lean proteins, I mean healthy proteins. Okay, example of a lean protein is chicken, okay, turkey, fish. I mean, make sure the fish is low in mercury. Okay, eggs, tofu, beans, and lentils. Okay, so this is because protein help you feel fuller, and also it balances the carbohydrates you definitely will be taking. Okay, another one is that 1/4 of your plate should contain whole grains, okay, which are high in fibers. Example of this is brown rice, whole wheat bread, oats, sweet potatoes, in moderation please. Okay, there are things you should avoid. Number one is you should avoid white rice, avoid white bread, avoid pastries like all those baked things like your donut, your chin chin, your all those baked things. Avoid yam is very starchy, okay, and this actually helps spike the blood sugar levels. Another one is eat healthy fats. Example of healthy fat is avocado. Okay, eating avocado, pear, eating nuts, eating seeds, almond nuts, tiger nuts, just eat nuts. Okay, and this is because they help you get satisfied very quickly. Okay, and this will reduce the number of or the quantity of food you eat. Like, it makes you satisfied very fast. Dairy is another thing you should also incorporate. Okay, so but you have to choose dairies that are low in sugar, and example of it is an unsweetened Greek yogurt. Okay, you can eat plain milk, you can take fortified milks like soy milk, almond milk. Okay, they are healthy too. And also eat small frequent meals. I mean at least 3 meals a day. You can also add little snacks, okay, but they should not contain high sugar level. Also avoid fruit juice, any type at all. Okay, avoid soda drinks, avoid sweetened snacks, avoid things that will just spike your blood glucose level. eat fruit as a whole. Don't blend your fruits. More like, okay, this is an apple or this is an orange, just eat it the way it is. Don't blend it, don't turn it into a juice. Okay, this is because when you blend it into a juice, it will increase your blood glucose level. Okay, the last of it is stay hydrated. Take water. Like, prioritize taking water over any other drink. Okay, prioritize taking water, because at the last run, water will always remain the best. Okay, so this is what a plate menu can look like for a woman having gestational diabetes. Number 2 is exercise. Okay, so you don't have to go to the gym to start carrying all those heavy things up and down. Okay, so as little as walking, like walking, strolling, is enough exercise. If you can't go out, probably it's cold out there or it's too hot out there, you can decide to walk around your house, walk around your garden. Okay, those few steps are actually beneficial. Okay, because what you're burning is energy, which is fueled by glucose. So you're burning glucose at the same time with just those few steps. Okay, but then if you have the energy to go ahead to do some active or more active exercises, you can go ahead, as long as it is safe for you during pregnancy. So the third one is monitoring your blood glucose level. Okay, so a glucose test kit can actually be given to you, or you might be asked to buy one. So this blood glucose test is usually done an hour after each meal. So before you eat your breakfast, you have to test for your level of your blood glucose. Then 1 hour after breakfast, you do the test again. Then at noon, you eat your lunch. An hour after eating your lunch, you have your blood glucose test again. Then at night, you also test for your blood glucose an hour after having your dinner. So this is how the blood glucose is actually tested during pregnancy if you have gestational diabetes. So it is proper that you test for your blood glucose level every day before your breakfast and 1 hour after each meal you have taken. But for some women, if this lifestyle changes does not work, like the exercise doesn't change anything, the dieting doesn't change anything, the monitoring of blood glucose level daily doesn't change anything, your doctor or your GP might end up prescribing an insulin for you to be injected every day in order to help manage the blood glucose rise. So after your baby is born, that is after you've given birth to your baby, gestational diabetes usually goes away on its own. Like when you go back to check your blood glucose, it will go back to normal. Okay, it's just because of the pregnancy hormones. Okay, but it is advised that at least 6 to 12 weeks after you've given birth to your baby, that you should go back to the hospital for a recheck of your blood glucose level, because for some women it doesn't go away, it will still be there. But a quick one, okay, women that notice that they develop gestational diabetes usually come down with type 2 diabetes later on in life. So in as much as you might go back and test and your blood sugar level is low, it does not mean that you should go ahead with eating just everything. Okay, the risk of you developing type 2 diabetes is very, very high. So it is advised that you still watch your diet, watch what you eat. Don't just eat everything you see, and then make sure your plate of food is still as healthy as it used to be when you were pregnant. Okay, so gestational diabetes is common. Okay, a lot of women have it. It's not a do or die illness or complication of pregnancy. The good thing is that with the right care, you will still have your baby safe and sound. Okay, so if you've had gestational diabetes before, or you're having gestational diabetes as I speak, don't be worried. Okay, the main thing is that it is possible to have a healthy baby, and then having this knowledge will help you reduce the risk of potential risk in the future during other childbirths or during other pregnancies. So if you've had gestational diabetes before, or you're having it currently, please drop your experiences and how you managed it in the comment section. Okay, please, if you find this video informative, please drop a thumbs up, subscribe to my channel, share this video out there. A lot of women need it. Okay, thank you so much for watching today's video. See you in my next one.